This is number 254. And I want to do something on post-COVID management and get on to some sociological topics. So what are the new things that you need to know about COVID? Everybody is worried about the long COVID effects. That is, why are people who are suffering, continue to suffer COVID effects is the worry of many people. So there are some new recent studies available why people continue to have symptoms like COVID and sometimes even COVID complications of thrombotic phenomena, and people die of clots in the lung or clots in the brain. Now that's a very serious concern. Without getting to the serious part of it, I will address that. I'm Dr. Lalith Mendis, and this is my clip number 254. Any other clips you want, you can have from 07631348800, the WhatsApp number. So after hospital discharge also, bed rest is important for at least 14 days to the extent your lungs are involved. If your lungs are not involved, strict rest for about 7 to 8 days is okay. But if your lungs were involved, you must absolutely rest at least for 21 days. Then you need to get a preview done and meet the doctor and check with him how you are progressing. Why is this so important? COVID infection affects almost all tissues and cellular systems of the body. The immune system is set wrong. WBC, DC and everything else is set wrong. So there is a serious problem that you need to address. And the best thing you can do is to rest when you come home. Many cellular systems are affected. As I said, the thrombotic system is getting back to normal. Lung endothelium, which means the insides of the lung blood vessels, the lung epithelium, which means the inside of the air cavities, all have been affected. So please, I plead with you, even after come home, if your lung was involved, then 21 days, almost near complete bed rest, you can just wash yourself, that's about all. Then, having come home also, you need to take the deep breathing exercises so that you breathe deep and hold your breath. And for a few days at least, it is important to do the exertional oximeter and keep a check on your pulse, because your pulse must keep at normal levels. So continue what your doctors may have asked you to. Some doctors may ask you to continue your budesonide inhaler. Some may ask you to continue dexamethasone for a little while, especially when your lung has been involved. Some antibiotics may be continued, and some people may put you on a blood thinner even after you are discharged. So when your lung is affected and you develop oxygen desaturation, you have to go to hospital. That may happen on the 5th day or on the 8th day. So if the fever is continuing, you have to be very careful from the first day of symptoms. Fever continues means that your lung is getting involved. If your lung does not get involved immunologically, so to say, then you are safer. So the disease has three processes. One, the viral entry, and the virus enters through the ACE2 receptor and spreads in the throat and may go to the lung. And in some people, it may not go to the lung. But when it goes to the lung, it doesn't remain a viral problem. It affects the cytokine system, and there's going to be an immunological, almost a warfare. The immune system in your body begins to go wrong. That's the effect of the spike proteins and the antibodies against the spike protein. So the lung epithelium gets damaged. Lung endothelium. Endothelium refers to inside the blood vessels get damaged, the small blood vessels. Then the third stage is you get a clotting tendency because of the blood vessels getting damaged. So by the time you are oxygen desaturation, you must be in a hospital. This same process may happen in the gut, especially with the Delta variant. You get a diarrhea, and the gut epithelium and the endothelium. Endothelium refers to the blood vessels. So this is why we have to take care. Then the home management system is this. When you get COVID positive, PCR or antigen, rapid antigen positive, you inform the PHI. They put you on the 139 system, which means it's a government arranged Ministry of Health on-call system. Level 1 is pre-interns or interns. Level 2 are registrars. About 200 registrars are involved. Level 3 are consultants. So they are on call. So at any time, there is a consultant accessible. When you are on the 139 system, please get on the 139 system, even if you hope to go to a private hospital, so that your home management will be good and complete. Then, good news is this: everywhere, beds are getting unoccupied in government COVID wards, even in private sector. ICU beds are a little more available. Oxygen beds are a little more available. So there is a decrease in the serious cases. We cannot still whether there's a decrease in the infection, but the serious cases are coming down. That's welcome relief. Now, when you have a person isolated at home, you have to have a separate bathroom for that person. You have to keep a stool outside, a little table, and then you keep stuff on that, and the person comes quickly and takes it inside, whatever that has to be taken inside. The person, if you are the one, if you're the husband watching with the wife, with home management, you must see to it that you have double mask, face shield every time you go to the door to give something. You don't go inside. Now, other critical point is about the oximeter. If you are oxygen desaturating, usually it happens after day 5, usually, then the fever will continue. So how to test is you put the oximeter like that, and you sit on a chair, and you have to do a 10-second sit down, sit up, sit down, sit up. And after you stop the 10 seconds, keep this on for 3 minutes and watch if oxygen is desaturating or not. That's the time that the oxygen level will come down, 3 minutes after you stop your exertion. Now, there is not severe exertion because when you get COVID, you have to rest as much as possible. There is just that 10 seconds up and down. If oxygen level comes down to, after 3 minutes, if it comes down below 96, you have to get admitted, because at that point you can't predict how much the lung is involved. So everybody's prayer is that lung, please don't get involved. And all treatment should be geared for lung not getting involved, and there are early molecules that can be given to stop lung getting involved. If you are on my FB timeline, you would have seen lots of my articles on this. Unfortunately, still in Sri Lanka, early molecules are not mandated by Ministry of Health, but the drug is now being imported with NMRA approval. So the drug is available. I can't mention the name because FB will take this out. That's how the anti-effort on this matter. So please, I'm Dr. Lalith Mendis. My last substantive post was as head of the Department of Pharmacology in the State Medical Faculty. That's why I speak a lot on pharmacology. If you want any of these dossiers, documents, my medical article on the subject is available on the newsletter of the College of General Practitioners of Sri Lanka and on the newsletter of the Independent Medical Practitioners Association. I can send you a WhatsApp link to it if you send me a WhatsApp to 076-313-4800. If you are living abroad, it will be +94 763134800. I can send you the documents also that are necessary. So the prevention of hypoxia, the lung getting involved, is the crux of the treatment that is still not happening. So what we can do is these early molecules that are available. The therapy was first recommended by Professor Thomas Borody. He's the professor who got the peptic ulcer triple treatment. So this one is also a triple treatment. This early molecule, doxycycline and zinc. Then, of course, from day 1 of COVID and even before that, you should be on vitamin D, zinc, and vitamin C. Moment you are diagnosed COVID positive, it is better to take a mega dose of vitamin D, 60,000 orally, it is possible. Then, what can you do to prevent your lung getting involved when you have been diagnosed COVID positive? You can take cinnamon tea morning and evening. Research has been done in Netherlands, and it's called the Ceylon cinnamon aldehyde research. And it has shown that cinnamon tea in adequate doses will prevent, at least reduce your lung infection. And it will reduce the amount of dexamethasone you will need later. Now, when your lung is involved, hypoxia has happened, desaturation happened, you must be in a hospital, and all hospitals in Sri Lanka use a thing called triple therapy, that is dexamethasone to contain the cytokine storm or the immunological warfare going on. Then you are given a drug called enoxaparin. All this is given intravenous to stop the blood clotting, and you will be given an intravenous antibiotic. That's the triple therapy. So I have to repeat this many times. So if your lung is getting involved and you are losing oxygen or oxygen saturation is going low, you have to get admitted to hospital. Then what more can you do before that? I told you cinnamon tea. Now a lot of research has been done about other nutraceuticals that are involved in this process that can be helpful. Western universities are doing the research, so this is not quackery. So Sydney University has done a research on ginger pepper, the effect of a brew with ginger pepper, Suduru and Nigella sativa is Kaluduru. Now this is our good old Rasam and Thembu Modi, and they are proving that it does have effect to prevent the cytokine storm. So it's anything that helps is helpful. Then garlic curry has the garlic has antioxidants. Then it has been proved that cloves by naturally has the highest ability to absorb per gram the free oxygen radicals that get released in an immunological warfare. Now, what is this immunological warfare? In our immune system, there's a set of molecules that go on the attack and mobilize the cells to swallow up the virus or the bacterium or whatever. Then there's a set of cells that cool this down. So IL-6, interleukin-6 is one of the most formidable attack molecules. Then interleukin-4, interleukin-10, and another one called TNF-gamma, they cool the thing off, pro-resolver molecules. Now, if you are low in pro-resolver molecules, then you're in trouble. When will you be low in pro-resolver molecules? If you are vitamin D deficient, if you are dark, beg your pardon, I have to say this to you, and if you have had an indolent indoor life, then if you are obese, then if you are a person who's all the time living in an environment of LED lights, long hours of work inside, all these people are prone to the cytokine storm. So what should you do? Take a large dose of vitamin D and attend on your lifestyle of habit. Now they have discovered a new hormone called irisin that comes up when you're exercising. So good exercise, keeping your sleep-awake cycles, all that are very useful to keep a healthy physique that can overcome coronavirus even if you are infected. So I made a bit of a mishmash of it. I started by the post-COVID recovery. Then I went to home management. Then I told you how to avoid lung getting involved. Once the lung is seriously involved, so you must, when you're sleeping at home, sleep on your tummy, because oxygenation and blood supply to the lung is best when you're sleeping prone, that your tummy down, and your shoulders a little up with two pillows or whatever. And then that posture of breathing, you have to maintain as much as possible, even in the night, so that your lung gets enough oxygen. Otherwise, lung tissue damage begins to happen. Then, because you are more or less not very active, what you should do is also that you need to exercise your muscles, not move the limbs while you are in one position. Tighten up your thigh muscles, tighten up your calf muscles every hour. Do a little bit of that, then just put your hands up like this take deep breathing exercises. All this goes to help keeping your lung oxygenated and preventing what's happening in other veins in the body. So I told you this early molecule that is very useful to. It's an amazing thing that everything that an early molecule does, that were recommended by Professor Thomas Borrelli, precisely stops the immunological damage that happens. Now, what is the immunological damage that happens? You have to get, your doctor has to order CRP, C-reactive protein. If it keeps going up, that means you are in trouble. If your WBC, full blood count, and in the WBC, neutrophils are 70% and lymphocytes are going down, let's say 18%, then what happens? Its ratio is 5, neutrophil to lymphocyte ratio. If lymphocytes keep going down, it's a bad sign that your lung is getting badly involved in an immunological reaction. If your eosinophils are coming up, that's also a bad sign. So what will a doctor watch? CRP going up, NLR, neutrophil lymphocyte ratio going up above 5.4, platelet lymphocyte ratio going up above 184, and then there are two other markers, LDH and ferritin. When LDH is above 400 and ferritin is above 500, you should be in a hospital by that time. Don't delay the hospital process because getting an ambulance may be difficult at the last moment. Keep tab with the 139 government system. Also, if you can't get an ambulance, you can ring up 247. If you are in touch with the private hospital, they also have ambulance system so that before the patient gets oxygen bed, you must be in a safe place. That's the last bit of home therapy, but you can do a lot to stop the stop lung getting involved. Professor of medicine has written about it, and then I have written this article in the College of General Practitioners newsletter. I have also written some documents which you can have if you send your WhatsApp number, and then we can send a WhatsApp message. Also, all my messages and clips are available on my app, which is Golden Nuggets. You can download it for free on Google or Apple Store. I'm Dr. Lalith Mendis. Then I told you after coming home or at the beginning that you have to do those muscle strengthening stuff. If you had diarrhea, you must take enough Jeevani, the oral rehydration solution. Remember, your life can hang on taking enough fluids. Tea 3-4 times a day is excellent. Cinnamon tea prevents your lung getting lung damage is minimized by cinnamon. So then there are some other molecules you can take at home. Bromhexine is a syrup. That syrup twice a day, morning and evening. Then budesonide inhaler. That is an asthma inhaler. This was proved in the STOIC trial by Oxford, taking budesonide inhaler reduces the lung damage. These are some things you can do at home to prevent lungs getting involved too badly. So then promethazine, an old drug. You have heard it as Phenergan syrup is not available. Promethazine, 25 milligrams morning, evening, protects the lung. Then fluoxamine. So obviously you don't know all these names, so I can send you a doc. It has been proved in research to prevent or stop the lung damage. Then if your lung is getting very badly involved, only of course these are only doctors should be prescribing. You can't self-prescribe. This is only a talk on information. This is not a prescription. You can't prescribe for yourself. You can prescribe for yourself vitamin D, vitamin C, and zinc tablet. That's it. Other things doctors must prescribe. Bromhexine syrup is a well-known syrup. So these molecules help. Then recently it has been discovered if the lung reaction is severe, there's a drug called metoprolol. So I'm in the process of sending all this stuff to practicing physicians that they may keep up with research. Yes. Incipient hypoxia causes high pulse rates. If you have a high pulse rate, you must know you may be running into low oxygen. Then after triple therapy, you may be getting a bit of gastritis. Then there's a syrup called Gaviscon. Do not return to vigorous exercise or work. Please listen to this. Even after 3 weeks, your systems can be fragile if your lung was involved. Please don't get back to your gym and big bodybuilding exercises. Be quiet as possible, please. So different things that the physician may continue, you'll have to take it. Then there's a old drug called famotidine, which is usually given for stomach problems, but that drug, famotidine, has been found to reduce the lung reaction. Restore sleep-awake rhythm carefully. So reduce LED lights. Please don't listen to clips. Please don't listen to television. Please don't listen to COVID news. Everything adds up to stress. As I told you, there's a new study. The spike protein makes antibodies in the body, and some of those antibodies attacks our ACE2 receptor. And a thing called angiotensin 2 can be high in you. When angiotensinogen 2 is high, your immune system flares up. When your angiotensinogen 2 is high, your immune system is always in flare up. This is why that early immune modulating molecule, which was used for onchocerciasis widely in Africa, and it is used for scabies in European countries. It is approved by the CDC and FDA since 1996 in US for human use. So to call it a drug used for dogs, horses, and cows is complete fake information. It is one of the essential list drugs in the WHO. It won the Nobel Prize in 1975 for its extreme usefulness. So it is not a sideline drug. It is a repurposed drug for this particular condition. So don't listen to all the fake news. So any bit of prayer, song, cheery atmosphere are always useful for your recovery. Yes, you may have excessive sweating. Anxiolytic sedatives may be necessary. Recovering your sleep-awake system and your metabolic clocks are very important. Onions, ginger, I told you, rasan, tambunghoti, all those help. Big bowl of fruit. Pineapple has bromelain. Apple, pear has quercetin. Onions have quercetin. Omega-3 fish oil capsules are helpful to recover your immune system. Kottamalli twice a day is excellent. Legumin protein in dal is helpful in this situation. Egg and fish, even meat, will contribute lysine, which is an amino acid that fights against the coronavirus. So these are some of the things in home management, post-COVID management, how to do home well, and don't get into trouble having gone through the COVID episode reasonably well. Do not go for exercise or work too fast. Now I want to read this little passage to understand our times. They hatch adders' eggs and weave spiders' webs. Now we can see that. I have told this often, COVID virus was made in a lab, foolproof. Quite a lot of proof is available on that. What seems to have happened is the old SARS virus has been hybridized its mRNA with a piece of the HIV mRNA sequence. So that's why this virus attacks your immune system. That's the diabolical part of it. Also, this virus can move from cell to cell without coming to your interstitium where the antibodies act. So though you have antibodies, this virus goes from cell to cell. That is why those early molecules that are given, the drug prevents this cycle going from cell to cell, this virus going from cell to cell. Very useful molecules. So this is about sociological change of this time. People are hatching adders' eggs. They are making spider webs to catch other people. And their webs will not become, acts of violence in the feet run to do evil. And here is the capstone. All of us growl like bears and moan sadly like doves. So what's your modus normally? Bear or dove? How have you thought of yourself? Now here is it how it goes. When we meet strong people, we go, we become doves. But when we are strong, we growl like bears. So in this time, what has happened on the sociological scene is a very strong contingent of growling bears have taken over the economy, taken over health control, taken over how to advise sovereign nations. So our own nation is not free, even its doctors and physicians, to make independent decisions. So there's a global diktat being laid down for the first time in human history via the medium of health. Nobody politics, economics, GTT or whatever we can understand. But here it is, health is being used to cause a global diktat that is moving us towards Orwellian animal farm. Quite the features of it are rampant. So we understand the problem. So therefore, what's happening is, listen to this long list, proclaim favor and understand the day of fury. So you can see that some people are furiously working a very small coterie of very powerful people, billionaires over 1 year, and they have decided how our health should be run, how our lives should be run, and the diktats are implemented through health policies. Every home is affected. That's where it is. The national governments are helpless because they don't know how they can run their nation. Shut down, open up, lock down, open up. It goes on and on and on. Israel is the most vaccinated country. They are into their third and fourth jab because infections are surfacing. So it's a time like that. So here is the list of things. Comfort those who mourn. So mourning increases. Grant those who mourn. Then bring some beauty to where there are ashes. So a lot of human endeavors have come to ash. Then oil of gladness instead of mourning. So 3 times in this passage, mourning, mourning, mourning. People have lost families. It's terrible. I get so many requests for prescriptions, which I send free of charge, of course, and with some advice. It's heart-rending. Every time some particular peer group that can look after fellow Thonians, So I'm Dr. Lalith Mendis. I came first in the island in the A-level exam sitting from St. Thomas's College, doing physics, chemistry, zoology, and botany. Then I entered Colombo Medical Faculty, and every exam I was batch top. In those days, I didn't believe that you need a good shepherd. I said my brain is enough for everything. But as my brain became more brilliant, my heart began to shrink, was my experience. So the brain brilliance and heart warmth follows the Boyle's law in physics. If you still remember the Boyle's law in physics, it says the volume is inversely proportionate to the pressure, which means when pressure goes up, volume comes down. So when brain brilliance goes up, I found that your heart warmth goes down. This I really experienced. So during that time of change, I said I need a good shepherd to watch over my heart, because though my brain is getting brilliant, I won most medals in the Colombo Medical Faculty. I was the top student of, then there were only 2 medical faculties, Colombo and Peradeniya. I won the prize for the top student. In spite of all this medical brilliance, my heart was not becoming better. So we who are into research, we look at patients and say, that's a good research case. Whether the patient gets healed or not was not important in those days. That person is very important for research was the thing that ticks in people who are into research. So I really had a change of heart and change of mind and so on. That's why I'm reading this passage. Please hang on. So we need a mantle. When they are fainting, everybody is fainting. And then it says, a time will come, we need to rebuild the ruins. That means sociologically, nations will run into ruin. I have done this before till 1970. There was a reasonable, equitable distribution of wealth. Actually, in 1960, 60% of world's GDP was owned or managed by 40%. So distribution are reasonably equal. But since 1970, John Maynard Keynes, economics increased the demand, increased consumerism and the supply. You can have unending economic growth, landed us in stuff that we really don't need. So housing, education, food, and health got actual health got less and less GDP. The fantastic things, fashion, perfumes, confectionaries, toys, armament, motor industry, pharmaceuticals, they increasingly took away the GDP and nations began to go hungry. So ruins that of things we knew, devastations of former foundations, and so we are in a season. We are called to repair the ruins and the desolations of many generations. That's what COVID has done. Our children's education, our children's future, our young people's vocational training, and even science. Recently, the British JCVI, the vaccination advisory body, said children don't need vaccines. But the health secretary says we need to have a broader perspective. So who's deciding science? Scientists or politicians? That's where we are. And for whose purpose is science making decisions like that? So you need to come to a decision whether you need a good shepherd in your life. You have heard the word Armageddon. It was popularized by Leon Uris, writing the book on Armageddon is a book by Leon Uris, the Berlin issue, how the Berlin Wall came up, the last days of the Second World War. And this Armageddon comes from a certain passage where there would be a complete collapse of civilization in the sense everybody is getting ready for war. I have done this clip before, clip number 244. Einstein said, if there be a fourth world war, he said, I do not know what weapons will be used for the third world war. It will be so sophisticated. But he said, if I know this, if there's going to be a fourth world war, we will have to use sticks and stones because there would be such a devastation. Are we coming to that? Can we stop that? So that is the Armageddon. So when bears, minuscule bears have made the whole world groan like doves, we have never had a situation like this in the world. So what is the promise that we have? We can comfort one another because there's so much of mourning. We can ask the good shepherd and say he has a promise. He says he will lead us into green pastures. And that is his promise, that he will keep our pastures green, that he will lead us into the next possible water spots, and he will lead us in right paths. He will give us a time of restoration and recovery from the damage. See the things it said, ashes, mourning, again, fainting, then ruins, devastations, ruin, repair of ruin, desolations of many generations. So across the board, children affected, young people affected, older people, their health really compromised. What a terrible time, isn't it? So across the board, this describes ruin. We need to rebuild, then raise up out of the devastation, repair the ruined cities. Cities are in lockdown, shutdown, whatnot. Then desolations across many generations. What I said, you know what desolation means? Once it was good, now it looks irrecoverable. But we can't lose hope, isn't it? So we have work to do, and we are called to do this work. And the Good Shepherd's promise is he can make pastures green. He can give us clean waters, clean morals. He can give us an hour of restoration, time of restoration, recover from all this damage. He can set our paths straight and right. And though we walk through the valley of the shadow of death, he says his rod, government, and his staff, his provision, can look after those who trust him. That's the Good Shepherd's offer. He says he can furnish our table and protect our head and fill our cup. That's the expression he uses. Protect our head is protection. Fill our cup is provision. Two utmost things necessary when every family is struggling economically, struggling health-wise. So may I leave you with these thoughts. Thank you for listening. Thank you for participating. Usually it's at this time that I come out with the English weekly broadcast. The Sinhala one tomorrow will be perhaps at about 1 in the afternoon or 2 in the afternoon. Tell your Sinhala language friends. I will send a Zoom link also that they can join tomorrow. Thank you for listening. I'm Dr. Lalith Mendis. If you want my app, Golden Nuggets, you can download it from App Store or from Google. And if you want any of these clips sent to you or documents sent to you, please send a WhatsApp to WhatsApp number 076 313 4800. Thank you for listening.